Good morning, good afternoon, good evening, wherever you're joining in from. Welcome back to Upper White. My name is Mamleyoko Godwins. I am a psychiatric nurse practitioner and I'm a single mother of two boys, and yes, I'm a proud divorcee. I come to this platform with information about mental health, parental alienation, family life matters, systemic injustice, and many more. Yes, I did a video on antidepressant withdrawal symptoms, and one of you guys, wonderful followers or wonderful commenters, asked me to talk about how to taper somebody off an antidepressant. In this case, specific one they are referring to is Effexor. So what is Effexor? Effexor is an SNRI, opposed to the usual SSRIs. But it is known as one of the notorious antidepressants that if you don't follow your doctor's directions and you quit taking it cold turkey, the side effects or the withdrawal symptoms you're going to get are going to be very, very undesirable. So I thought I'd bring this to your attention today. I want to finally respond to the person. Understand that this is not your doctor's advice. This is an information that you will take to go to your doctor and ask further questions about. Okay? That is, if you are taking it and you have plans of quitting it and you want more details about it. Welcome, my Facebookers. If you are here, I just want to invite you to join us on YouTube. I'm on YouTube Live, and that's where I'm doing this content at, since that is more of my educational piece platform. Okay, so Effexor, like I said, it's one of the notorious and so notorious antidepressant that you don't want to just stop taking abruptly because of the undesired antidepressant withdrawal symptoms or syndrome complications you're going to get. It is generally prescribed. The base dose for Effexor is 75 milligram. However, it can go up to 225 or 275. That is the highest dose you can get. So imagine having that, and then you want to quit taking that. You cannot just stop taking it right away. You have to follow a protocol to be able to wean yourself off it over a period of time, which we're going to discuss that in a little bit. If you quit taking it right, cold turkey, especially if you're taking high doses, it can lead to what? The same symptoms you were having, and even worse. You can become manicky, you can become suicidal. A lot of things can happen. The duration, if you're taking Effexor and you stop taking it, from the time you stop taking it, 8 hours from the time you stop taking it, up to 12 hours from the time you stop taking it, that is when you are going to start experiencing withdrawal symptoms. And that is very important for you to take note, so that you pay attention to the undesired symptoms you'll be feeling, seeing yourself go through. Good morning, everyone. Effective withdrawal symptoms are among what are some of the is not different from the SSIRs like I've been describing, but it can be serious. It can be more serious even than the regular antidepressants. So it's important that you take note of that. What are some of the symptoms you're going to get? I talk about the worst ones, which is what? SI. So you can be suicidal, you can be manicky, you can have GI effects like undesired upset stomach, stuff like that. You can have vertigo, you can have anxiety, very, very bad anxiety. It's like we are withdrawing. So if you are withdrawing from a drug, from alcohol, from cocaine, what happens? You'll be jittery, right? You'll be anxious. You'll be very, very restless. Yes, it can be scary, right? That's the same thing. You're going to get anxiety, irritability. You're going to get insomnia. You're going to be insomniac. Sometimes when the suicidal ideations comes with vivid dreams, all the symptoms that your the antidepressant is taking care of, they are going to come back in the worst form. And that's why you want to keep your neurotransmitters balanced, the serotonin levels balanced in your brain, so that that don't happen. Because once you withdraw it, the balance gets shaken. It becomes imbalanced. And that's what can cause you to have the vivid dreams, the suicidal ideation, flu-like symptoms, like we are withdrawing from cocaine, the flu-like symptoms, nasal drainage, all of that. Okay. Loss of coordination, loss of focus, loss of attention. And I talk about the timeline. If you've taken Effexor right now and you stop taking it, from the time you stop taking it, expect that you may start having the withdrawal symptoms within 8 hours, 8 to 12 hours. And that is reported by researchers that at least 20% of people who do that will start seeing the withdrawal symptoms within 12 hours at most, within 8 to 12 hours of when you stop taking it. You understand? Some studies that have shown that cognitive behavior therapy, this is the thing. When you want to stop taking it, you have to make sure that you are addressing your health needs. The reason for which you are taking the antidepressant, you are addressing that. So you can be doing therapy. So the therapy will help you to becoming in terms with it, that you are going to withdraw it. And when you withdraw it, these are the symptoms you are going to experience. And when you start experiencing these symptoms, this and that is what you should do to help you not get to the worst ends of it. Okay. So it's important that you know that an Effexor taper schedule may vary from person to person. You can do the same tapering process for someone who is taking the base dose, 75 milligrams, and then also the highest dose, 220 or 375. You can do that. So it varies from person to person. And the usual way of doing it is to do it gradually, 10 milligram, taper it down 10 milligram at a time. The Effexor dose, you have to decrease it by 10 milligram every 2 weeks. So let's say you're taking the maximum dose, right? Which is what? Between 225 to what? 225 to 375? Is that what it is? Yeah. 225 to 375, right? So let's say you are taking 375. You want to taper it every 10 days at least, or, you go down to 375. So you're going to take 365, right? You're going to do it that way for approximately 2 weeks, 10 days to 2 weeks, for a minimum of how many weeks? 4 weeks. 4 weeks. They say what? A minimum of 4 weeks. Meaning that you can taper it down. Every 2 weeks, you go in 10 milligram. If you are on 375, you're going to go beyond 4 weeks, because every 2 weeks, you're going down 10 milligram, until you fully covers the period that allows you to come off it. You understand? And then your doctor, it's also important that you know that you have to be working hand in hand with your doctor to develop an appropriate plan that works for you, not based on what I'm saying. You have to work with your primary care physician. If I say primary care physician, not your primary care physician, the primary care physician for psych, like me, nurse practitioner, or your psychiatrist, or another nurse practitioner that prescribes psychiatric medication, psychotropics. Okay, it's not every doctor that prescribes the medication I prescribe. Just like I cannot go and prescribe a diabetes medication or blood pressure medication. That's how it works. I deal with psychiatric conditions. So I do the assessment, I do the evaluation, I diagnose, and I treat with medication. Okay, I provide coaching also, like dietary coaching, behavior modification coaching with the treatment. But I don't do that in my practice alone. I only do that under EPA worldwide. Okay. In addition to things you can do other than doing the cognitive behavior therapy during the period that you are about to get off the Effexor, or you are also taking the Effexor and you want to get off it, you have to have a backup plan. If I'm having these symptoms, how do I cope with it? Hence why you must start the CBT, cognitive behavior therapy. So the therapist will be at your corner and help you to do it effectively, right? So if you don't need the medication, well, what other things can we do to help foster coping whilst you are getting off it? Also, diet. Diet is an important aspect to not ignore. You have to make sure that you are considering what diet helps to stimulate positive mood, help with your turkey itself. It has a antidepressant component in it. So you have to learn about food items that help enhance the mood, help you stay up to your max potential when it comes to your mood or whatever, when your depression or your anxiety, whatever you are treating it with. Okay, you have to consider regular light exercises like yoga. Those are some of the things you can do. Staying well hydrated is important. Consider therapy and counseling. We talk about that. Alternate treatment for Effexor. There is a way also that you can taper yourself off Effexor. That is called cross tapering. That may be what effective method to prevent or to minimize the effects of the antidepressant syndrome, withdrawal syndrome. Cross tapering just involves what? Transitioning from one medication to the other. So you're taking Effexor now, but the goal is, oh, I don't want it. I don't like how it's making me feel, or it's not effective. Okay, so what do? You want to, when you start tapering, they start tapering you off it. Don't forget 10 milligram every 2 weeks until you are to completely off it. So at some point when they want to introduce a new drug, that is it. So you are taking Effexor, but they want to introduce like Zoloft, which is SSIR. So they want to take this off, be tapering you off this, and at some point introduce the Zoloft on board, right? So that is cross tapering. So the reason why you do cross tapering is so that you don't go through the withdrawal symptoms that are undesired that we're talking about. And according to research, one of the medications that you can actually switch from, like you are taking Effexor, right? So you want to cross taper. You want to take the Effexor off, introduce something. They said that one of the medications that has similar composition or components or structure, chemical structure, as Effexor is what is Cymbalta, the L'Occitane. So that is what most people use often when they want to take you off the Effexor. They give you the L'Occitane in place of the Effexor. They said that it has what similar makeup, like the similar composition or chemical formation. However, there is what a risk of serotonin syndrome. That's another thing to look for because you already have this on board. It's providing you with the serotonin, right? You are introducing another drug, which also is supposed to enhance serotonin level to decrease your depression and anxiety. You need to be careful because if not, both are increasing your serotonin level. So if both are increasing your serotonin level, you're going to end up having something called serotonin, there is a name for serotonin crisis or serotonin syndrome. It's called serotonin syndrome. Yes, you're going to have serotonin syndrome, and you don't want that. Serotonin syndrome is an undesired side effect that you can have due to overdose of the drug. It affects all your systems, your blood pressure, your temperature, your GI tract. You get, what's the name? Motor function, like movement and all that. It's very bad. So you really, really don't want to have to deal with serotonin syndrome. Okay, that is just an overdose of the drug. That's what that does. So detoxing you from, if you want to detox from Effexor at home, what do? Many people who stop using Effexor either abruptly or with taper do so at home, which that's what's going to be, because you're not going to come and stay in the hospital for the doctor to be tapering you off it. No, that's not how it goes. You are going to be at home. They are going to decrease your dose. They're going to tell you for the next 2 weeks, don't take this amount, take this amount. So just so you know, it doesn't happen in the hospital, whereby when you're having the on the side withdrawal symptoms, anybody can respond. So you need to learn about the things to watch for, how is the changes you may see, what to do if they happen before you even start the process. So it involves a lot of education between you and your provider. Okay. Since quitting abruptly can cause what? A risk of antidepressant withdrawal syndrome. We discussed, if you haven't watched antidepressant withdrawal syndrome, it's the video I posted before this video. It's on the page, or at least one before this one. This includes what? Having, what did I say? Yeah, if you are doing it at home, you also want to talk about your support systems. If you have a friend, family member, whoever is involved, so that they will be paying attention that, hey, I'm doing this. So if you see me talking irrational, if you see me very manic, if you see me trying to crawl and think I'm seeing things, or you see me trying to jump off the roof, please take action, because this is what I'm doing with my health. I'm trying to get off this medication. And these are some of the things that may happen. I may not realize I'm doing them, but if you see me doing it, please come to my aid and help me. You understand? So make sure you include your loved ones, your friends, your support system to be involved in the process. That's all I have to say to you today. So it takes a period of time. The thing to consider is how much dose you are on. What are the patient variables? What is the age of the patient? What other medications are the patient taking? How much, how often? You know, I know sometimes people take it twice a day, once a day. It depends. Okay. So those are the things you put in consideration. The most important is how much you are taking. Your patient variables. What other medications are you taking? And understand that it lasts over a period of time based on how much how much dose you are on. You taper it 10 milligram every 2 weeks. I'm taking 75 milligram. I don't tell 75 milligram that I know it's a capsule. So I'm not sure about that. But if you're taking higher doses, yes, they may also do maybe every other day. It all depends on what the patient can tolerate. And they may start one, and if they will suggest to you, if this doesn't work or this make you feel some weird way, then do it this way, switch to this, switch to that. Yeah, so that's how you taper yourself, or not yourself. This is how you talk to your doctor to help you get off I have found a research article that was very, very extensive on the Effexor also. I don't know if I want to discuss that. I don't want the video to be so long, so I'm going to leave it. But there was this research that was conducted, and though Effexor is not used most often in children, it was said to have a very, very good effect with anxiety in children. So we have a study in Canada. There was a research done by Dr. Raj and Dr. Sik in Canada, they suggested that unlike the SSRIs, the Effexor is one of the very good ones that is used to treat children with anxiety. But when you want to taper the kids off it, it takes a very, very bad process. It has a very negative effect on them. So it's important that you always talk to your doctor. Okay, don't take what I say. Don't come here, and what I say here is for informational purposes, so that when you leave here, you go and talk to your primary care physician or your psychiatrist most of the time, depending on who is prescribing or managing your antidepressants or your bipolar medication or your schizophrenia medications. That's how it goes, guys. So I'm just going to read a little bit of the conclusion. It said, in consideration, the use of SSRI in children, physicians must seriously weigh the not so clear benefits. Understand that the researches are not done in children. The research is not done in children. Thank you. The research is not done in children. Who want to give their kids up for such studies to be done? You understand? So most of the time, they use these drugs as off-label. When it comes to mental health, there is so many medication we use as off-label. I have found a lot of benefits using even anti-blood pressure medications in treating some anxieties and some diseases, some psychiatric conditions. Okay, so yeah, just so you know. And so, it says that, who is this? Not so, okay, so you have to weigh the benefits against the risk, because what? There are no research. There is no extensive research when it comes to the psychotropics used in children. So it's pretty much, it's sad to say, but that's the fact, pretty much like a trial process. Oh, let's try this and see. Let's try. I don't want to say try and error, but this is what the medication does. Evidence-based practice says it's an antidepressant. So it's good, and it helps with antidepressant and anxiety, right? So it's going to work for it. However, it may work for patient B, it may not work for patient A. So it's all like a trial-based approach. And so you have to weigh the benefits. Benefit based on the patient history, genetics, patient age. The patient variable is number one thing to look at, to focus on when you are trying to choose a medication. Or in the patient history, there may be a family member that is in the family that is using the specific medication that also has been effective. So you want to choose that. Sometimes that's the way we choose. Good morning, everyone. Good morning. So the frequency and severity of this reaction seems to be dependent on what? The SSRI half-life. That's one important thing also. Aside the patient variables I'm talking about, the half-life is important. The half-life, like you take Zoloft and you take sertraline. Zoloft have a long half-life. So that is the type of medication we give to somebody who don't like medication. Somebody who travels, who travels for job. So and they don't have time to be stopping to take medications frequently. So you want to consider the patient variable. You want to also consider the half-life of the drug. Another main thing is also the 450s. The 450, the P450 enzymes. Some may not be compatible. If you have you are taking it based on, like we have some, like Asian people have certain enzymes that makes them not to take another medication, or if they take another medication, it's going to decrease it. Or you smoking, or you taking certain foods. A lot of variables, people. We consider a lot of variables before we choose a medication for a patient. So that's one thing you need to know. Okay, the half-life, the patient variable, the patient age, family history. Is there any family member that is on this medication? Yeah, another thing. So peace out. I just want to let you know this question has been there for so long. The patient one of you want to know how to taper someone off Effexor, because I did the antidepressant withdrawal syndrome video. It's on the YouTube channel. It should be on the page also. And this is what the question was. How do I taper someone off antidepressant, specifically Effexor? So that's how you do it. You decrease it 10 milligram at a time. 10 milligram at a time, and over 2 weeks. So every 2 weeks, you're reducing the dose. Every 2 weeks, you reducing the dose. And then whilst you're doing that, you don't do it just like that. You also have to find out, okay, do I have support system? Is someone observing me to see if I'm showing some symptoms that are not desirable? I'm doing something that I don't know. Okay, do I have support system observing that? Did I bring someone on board with my treatment plan? Okay, another thing, okay, am I going through therapy to help me with coping naturally, with some coping mechanisms versus the medication? All these things. Diet is very important. So these are the things you do if you want to taper yourself if you want your doctor to taper you off it. Okay. All right, I'll talk to you guys in the next video. I would like us to talk do a video about anyway, I'm going to end this video and I want to talk about family therapy on the page. So let's meet on Facebook. Thank you guys for being my audience this morning on YouTube. Thanks for your support. If you haven't watched the YouTube video, don't forget to share it. Don't forget to come on board from Facebook and watch it to support. God bless you. Till I see you again. Bye-bye. How do I get off? Okay.